All right, guys. So today we're going to be covering arthritis a little bit. It's a relatively short section in chapter 10, but definitely necessary to cover because, believe it or not, arthritis is actually pretty prevalent. Not just in your normal population, but all over. Kids, adults, the elderly. So we're going to go ahead and go straight into it. What is arthritis? Arthritis is just it's a disease that causes pain or disability in joints or anything similar to that. It also has a couple related conditions. It can lead into other things as well. Uh, Little do people know, it's also the leading cause in the U.S. of pain and disability. About 22.2% of the population in America is affected by arthritis in its many different forms, which is about 50 million people roughly. Um, so it's more prevalent than you think. So common symptoms, it's pretty basic. It's just going to be like swelling in the joints, pain, stiffness, decreased range of motion, things like that. Anything similar to those will have relative arthritis symptoms. Um, who does it affect? Like I said, all ages. It's not just a population based, like the elderly or the young, but it's affected all races, all walks of life. There's also a small correlation with the elderly in arthritis diagnosis. As we get older, our joints begin to, or the pockets of air between our joints become to get smaller, and our bones begin to rub together and cause arthritis and things like that. And especially after years of abuse, such as like athletes, especially runners, people who run on hard surfaces or do things with high intensity, they have a higher risk of arthritis later on in life. The two most common types are osteoarthritis and rheumatoid arthritis. You've probably heard of them before, but those are two of the most diagnosed arthritis. Uh, so, osteoarthritis and rheumatoid arthritis. So, first off, osteoarthritis, it's a degenerative joint disease, affects one or multiple joints. Uh, it also has its hotspots. So, it can be seen mostly in your knees, hands, spine, and hips. Basically, the joints that you use the most. And it also affects, for the most part, the ones that have the most range of motion. So, like your spine, your hips, and your knees, they have a good amount of range of motion. And then your hands are using them all the time, so it develops osteoarthritis as well. Um, Rheumatoid arthritis. It's a chronic systematic inflammatory disease, attack from the patient's immune system on the joint tissues itself. So your body's attacking itself, and it basically breaks down the tissues in the joints that protect them. Um, the other common types are fibromyalgia, gout, and bursitis. Some athletes will deal with bursitis in their knees or in places of large ranges of motion as well. So, your special considerations, specifically for exercise testing. Um, each case is different. Each person has their own pain tolerance. Each person has their own severity of arthritis. You're not going to get one individual that has the same. Um, so for them, we always start with 5 to 10 minutes of adequate warm up. Could be a stationary bike. It could just be stretching, things like that, just to make sure that the joints aren't cold going into a workout. Um, so for them, exercise testing, you want to really avoid a high intensity workout. Um, it's contradicting to acute inflammation. So your hot, swollen, and painful joints, it's going to be contradicted, and it's going to, in the long run, hurt your patient. Um, if your patient is going through a spell of an acute inflammation, it should be postponed, or the exercise testing should be stopped immediately, and then looked at later. Uh, some individuals will have a hard time with like walking or running. So treadmills aren't always the best way to go, or hard surfaces. So you should substitute this for like a stationary bike or something more or less strenuous on their joints, and more effective as well. So also, like I said, allow ample time for your patient to get warm. You don't want them to be cold going into the workout. Um, Also, you should be monitoring their pain levels at all points. Um, Through the exercise testing, you should be asking RP, all these other things, taking blood pressure, but also asking their pain levels, because if it gets too high, you're going to need to stop the test, because you don't want your patient in too much pain and them having an acute flare up. So we're going to move on to exercise prescription specifically. So for your exercise, you always, like I said, you always want to do your 5 to 10 minute warm up, no matter what it is. But you should also have an adequate cool down. Most people don't think about this, but an adequate cool down can help your patient in a lot of different ways. RPE and pain levels should be recorded during exercise, regardless if you're doing a very light activity or you're doing a moderate activity. The fit recommendations are 40 to 60% of your VO2 reserve. And for your deconditioned patients or people who are sedentary, you want to do about 30 to 40% of that VO2 reserve. Also, due to certain people's pain tolerance, like walking, running, lifting weights, biking, and swimming, certain activities will bother certain people. So you may have someone who can't swim very well with their pain tolerance, or they can't bike, but they can walk a little bit, or they can lift weights, or vice versa. It's really just up to the patient itself. You want to do resistance training about 2 to 3 times per week. Also include flexibility training with that. So just to increase range of motion, get the joints moving around a little bit. That should be light to moderate in intensity. You don't want to push your patient too hard to where they're having pain. We'll actually get into that in the next slide. And you want to do aerobic exercise, either it be biking, walking, swimming, or things like that, of a moderate intensity, 3 to 5 days per week, depending on your patient's pain levels or things like that. So your goal for exercise prescription for arthritis, you want to get them moving for about 150 minutes per week in aerobic exercise itself. So regardless of what you're doing, you want to get them moving at least 150 minutes per week. Progression, you can start them off slow, twice per week. It's always a good start. Start low, figure out their pain tolerance, things like that. You don't want to get them into vigorous activity immediately and causing them too much pain, because then you have to back off and you have to wait even longer for them to heal and for them to get back to the level of readiness for them to be working out again. But progression in the aerobic resistance and flexibility should be gradual. Now we're going to move on to unique special considerations. So there's a couple of these. The first one, avoid strenuous activities during acute inflammatory flare-ups. You don't want to have them exercise while they're in severe pain or their joints are swelled, because then you're just going to make it even worse. You want to encourage your patient to exercise during the times of day where their arthritis is at its lowest pain level. So either being in the morning or late at night. It's all up to the patient, maybe midday when they've been sitting down for a little bit at their desk job or something like that. But you always want to encourage them to exercise in the points where they're hurting the least. I found this one quite interesting for water exercise. The appropriate or best temperature for arthritis people or people diagnosed with arthritis is 83 to 88 degrees Fahrenheit is the ideal temperatures, or 28 to 31 degrees Celsius. Anything too cold will be bothersome to the patient, or anything too warm will inflame their joints even farther. So you want to make sure you are aware of that, pull temperatures and things like that. Appropriate shoes. No matter what exercise you're doing, you should always have appropriate shoes. Even if you're not exercising, you want to recommend that. I mean, if they have knee pains or pains in their ankles, you want to make sure that they have quite adequate shoes. Thick insoles, comfortable, and make sure that they're relatively new and not worn out. You don't want to have a patient come in with a old pair of dusty shoes from 2012, no outsole, no tread on the bottom, and they're complaining about their knee pain, but it's really more related to the fact they have no cushioning in their shoes. Um, Also, you should communicate. Slight soreness in joints is going to be, it's going to happen. It's normal, but the kind of trigger for this to know when you should kind of hold off the reins a bit when you're exercising is if their pain post 2 hours of exercise was greater than before they started exercise. You need to dial down your exercise prescription. You need to dial down their plan. You can't have them work out too far or too far in advance or do things too difficult. You need to work them into those exercises a little bit better. You also should incorporate some functional tests or exercises. So like a sit to stand or step ups, walking upstairs, things that can translate into everyday life. And that's about it. Hope you learned a little bit.